Do most IgE serum and skin prick tests cover as many allergens as your LRA by ELISA Act delayed sensitivity test? Can you explain why a delayed food or chemical sensitivity could manifest in symptoms that look like an IgE reaction, such as pruritic rash, swelling, redness, tongue tingling, sinus congestion, etc.? Is it simply all about timing after exposure? Or is that allergen triggering both an immediate and delayed immune reaction? But no one is or can test the IgE response to it.
Well, with regard to what the different categories of immune response are, which is the heart of, I think, the question. There were two people, Gell and Coombs, and in 1964, they published that there are 4 classes of immune response based on the timing and the mechanism. If it's an immediate response, you get stung by the bee and you get hives or wheezes or itching or even anaphylactic reactions. That's classic IgE histaminic reaction. Then there are 3 kinds of delayed reactions, the type 2, 3, and 4, the antibody but harmful antibody, immune complex, and T-cell responses, showing how important it is to be tolerant in the immune system when you're healthy, and how many ways the body has of responding to compensate for intolerance. And now an observation that surprised me, but has been made many, many times by colleagues, spontaneously. When you restore tolerance in the immune system following the LRA by ELISA Act tests and plan, the seasonal, the IgE, the type 1, the immediate reactions, the ones that are measurable by prick skin test or RAS serum test, go away on their own. And then I looked at the literature. I mean, way back before the internet, there is a literature, scientific literature. And the allergists whose shoulders we stand on, the people who founded the field of allergy, reported that when they improved digestion, which to me means they improve the tolerance of their immune system, and reduced the burdens that caused delayed reactions, the spillover reactions of type 1, IgE, the ones measurable by skin test, often go away on their own. And I can explain, but it would take quite some time, the molecular mechanism of that, why cells become less histamine responsive, why they have less reactive neurochemical in the granules of their basophil or eosinophil or granulocyte or platelet. So these questions, when we get into molecular biology and how the body really works, the physiology before pharmacology, if you will, I find it fascinating. I'm really delighted to be able to explain what I can and tell you what I don't know and I don't. But bottom line is that allergists, my colleagues who practice allergy management or allergy and immunology, who do skin tests or they do RAS tests, then their standard of care is to suppress the reaction with antihistamines or other suppressive remedies. And I do talk with colleagues when they're receptive and explain the value of doing functional testing, a new generation of LRA by ELISA Act tests that give you intolerance reactions, delayed reactions, which turn out to be much more important in the body than the acute reactions. And I suggest that while it's not in any way intuitively obvious, it is very likely that the immediate reactions, the histaminic reactions, are spillover as a consequence of intolerance, maldigestion, dysbiosis, and its many consequences. So the bottom line is, do the LRA by ELISA Act functional tests, follow the plan, and if you find people do still have remaining seasonal IgE type reactions, such as the ones you mentioned. Have them do a C-cleanse once a week because nature's antihistamine is ascorbate. If you want to wash the reactive stuff off the cells, if you want to downregulate the hyperresponsiveness of these dendritic granulocytic cells, ascorbate is number one. Polyphenolics like Perk Pain Guard and Perk Repair Guard are number two. And I would recommend measuring the urine pH because if there are metabolic acids that are in excess and on rising the urine pH is less than 6.5, then there's an urgent need to replenish magnesium and through choline citrate, Perk Mag Plus Guard 2 capsules, and a teaspoon of choline citrate in the liquid of your choice. You can combine that with vitamin C to reduce the reactivity, to reduce the vulnerability, to improve the physiologic function and protection of the very cells that are measurable through skin prick tests or through RAS tests. And so I urge folks to use physiology before pharmacology and to understand that maybe the type 1 reactions that are immediate in time are alerting us to the delayed reactions, to the intolerances, to the maldigestion. And when you correct all of that, very, very often, I will even say consistently, the seasonal or the type 1 or the IgE or the histaminic reactions, the RAS testable reactions, the skin test reactions diminish. And a few people have gone back to their allergist and been retested by prick test, by skin test. And the doctor says, my gosh, maybe you're immune deficient because you're not reacting. No, their immune system is more tolerant and therefore they're not reacting. So there's lots of silos in medicine. There's lots of people who know a lot about something, but then comment about areas where they don't know much. And the area of functional immunology just began in the early 1980s, and we were among the pioneers, and have continued to show that with diligence, you get really interesting information by letting the body talk to you in the laboratory, just as it reacts in the body. And so LRA by ELISAC tests are functional. That is, we're getting the same reaction as would happen in the body because everything that would be in the body to react, including antigen-presenting cells and platelets and others, are all present in the LRA assay system. So we're a new generation of functional testing, and we're glad to provide the information that in many cases allows for a downregulation or turning off those histaminic, inflammatory, repair deficit responses.